I've never just prescribed fentanyl for pain for a patient, ever.
He's one of the sharpest, smartest guys I've ever known. And if you ever get in trouble with the law, call Rich Warfield. He's the guy in Dallas,
For sure.
But we were talking about fentanyl.
Ooh.
So, you know, as somebody in your industry, in your as you serve your community as a healthcare professional, you know, pain management, breakthrough pain, all these ways that big pharma has made pain seem so. This coming from a guy. Yeah, I've had 18 surgeries from sports injuries, rugby, fighting, snowboarding, whatever.
Well.
So pain is not anything that's foreign to me.
Right.
I just never got twisted off or squirreled off with pain meds because they made me claustrophobic.
Okay.
Percocet.
Right. The side effect was a good thing for you.
Yeah. But I used alcohol instead.
Oh.
So I was like, hey, what's wrong with just... So my first shoulder surgery, they sent me home, full reconstruction, put a bunch of studs in there. Very painful. I had to sleep in an easy chair for like 8 months, right? Because, I mean, the thing was totally destroyed. They forgot to turn the pain pump on. So I get home, I'm like, boy, I must be soft.
Right.
And the pain meds were making me really claustrophobic. So I just started pouring a 3-finger of vodka.
Yeah, I got patients do that too.
Knocked that out, and I was like, okay, I can deal. Doesn't stop up your digestion or. As a doctor who helps people with pain, what's the whole with the introduction of fentanyl and just where'd fentanyl come from?
I mean, so fentanyl's fentanyl is a super old anesthetic. You know what I'm saying? Like we've been using fentanyl for years, decades, using fentanyl for pain. The same way you go and you get morphine if you have pain, or you get dilaudid, right? You're a sickle cell patient, right? There's certain levels of pain medicine that help certain people. Unfortunately, we have this thing where pain is this vital sign that you got to address all the time, right? And so before, like, you know, our grandmas, what happened to our grandma? She cut her finger. What was she going? Like, you know, our great grandpa lost a finger. What would he do? Whoop, and keep it going, right?
Yeah.
Somewhere
Super
over
glue.
time, right? And but did they die? No, right? Did they die? Not at all. Somewhere along the line, we made like fentanyl this big important. We made pain such an important vital sign, right? So fentanyl's been used in the ICUs for patients. It helps people like you know, burns and things like that. When I was for chronic pain, it's the patches that were huge for people, right? Like because we start off with these medicines like Percocet and hydrocodone, and you have these little small problems. You have a little break here. You might have to have a tooth pulled, and I don't care who you are, your body's gonna become tolerant to the medicine. Like you might not be addicted to it, but you're gonna get used to that stuff. And so, you know, over time, these people needed other medicines. So fentanyl, they're like, well, let's turn to a patch, right? You can't take fentanyl home because it's IV, right? It's so strong, right? But you weren't taking oral. You're not giving patients oral fentanyl. How do you get, because it's so strong and dangerous, it has to be in a patch. You put the patch on the skin, it transdermally goes to the skin, right, to your blood, and it goes to your body. But even with the patches, I saw abuse. Like one time we were in the ICU, this lady kept coding. This is like my first year internship. In the ICU, she keeps coding. We can't figure out. We're looking at bladder. We're looking at bowel. Looking at blood, heart. No one can figure out why this lady keeps coding like 4 or 5 times. Someone's like, check her mouth. Check her mouth. Right. This lady packed in 4 75 microgram fentanyl patches under her gums.
What?
People were
like she's dipping almost.
Yep, right to her gums.
Whoa.
So people are already in. So the potential of fentanyl has been there. Like it's how bad it could be, right? Someone got the idea that making synthetic fentanyl was going to be a jam or something like that. I don't know why there's. The question I have is like I don't know why it's somehow so much flooded into the country.
Does it have a medical use? Like do licensed medical practitioners use powder? No. This synthetic stuff.
You're going to get an injection if you're asleep. For instance, best way to explain this. Some procedures, you don't need to go to sleep. If I do an injection in your neck in the surgery center, right, they give you fentanyl and Versed, a pain medicine that's fast-acting, that's very potent, right? But controlled to help you through your small procedure for 10 minutes because we don't want you going to sleep, right? So it has a very short, they give it for acute pain and they give it during procedures usually. So it's an anesthesia, they use it for anesthesia or in the hospital, and people need pain control, they'll give you a patch in the hospital. I've never just prescribed fentanyl for pain for a patient ever in the hospital.
And here's a vial sample,
right?
Yeah.
And so now, like everything else we do, we always take we can't chill on anything, right?
Yeah.
Everything we do, we gotta take extreme. So now, oh well. People, I'm sure somewhere online, people were testing out more drugs.
Hey, what's up? Thanks for checking out my videos here on the JESS Marshall YouTube channel. Be sure to subscribe for sure. Hit that bell. Press that button to watch the next video. If you got a question you have about any of the topics I bring up in the videos, drop a question below, and we'll be sure to get an answer back to you ASAP. See you on the next one.